Hello everyone, my name is Lucy. Today I want us to talk on another topic that is very important. It is known as antepartum hemorrhage, bleeding in early pregnancy. Bleeding in pregnancy, especially in early pregnancy. This is one of the obstetric emergencies that when you see one, you have to take an immediate action. Why am I saying this? It's because it is not normal for a pregnant woman to see blood of any kind when you are pregnant. Some are harmful, whereas some are harmless. But how can you really tell the ones that are harmful from the ones that are harmless? That's why I'm making this video today. If you are pregnant, especially before 24 weeks gestation, and you happen to see blood, be it spotting, be it after urinated, maybe you cleaned up and you are seeing traces of blood, go to the hospital, because it's when you visit the hospital that they are able to check and make sure that the blood you are seeing is the one that is not going to cause any harm. Without them identifying that, you can never tell the one that's going to affect you or the baby and the one that are going to amounts to nothing, because some of the bleeding we see in any pregnancy, some of them are not harmful. Some, even after seeing that blood, you can still carry your baby to them and give birth to a live child, whereas some, after seeing it, if neglected, can lead to miscarriage or abortion. Is there anything that can lead to this bleeding in any pregnancy? Yes. But before we go to that, I want you to do something. If you are pregnant, I happen to see blood when you are at home or anywhere, one thing I need you to do is to make sure that you pad yourself. The reason is this: it is through the pad that your healthcare provider is going to know the amount of blood you've lost, even to determine the color of that blood. Because you can walk into the hospital and said, so as I was saying, if you come to the hospital and said that you are bleeding, your healthcare provider cannot really determine how much you've lost. And again, through the amount of blood you've lost, we can actually determine what might cause the bleeding in the uterus. There are a lot of things that can cause the bleeding, but if you're able to put patch, she can be able to determine the amount and again the color. Because I have seen a woman that came in when I was on duty. She said that she was bleeding and it was much. When I checked, it was show. She was seeing show. So it wasn't actually bleeding, although it was mixed with blood. So without you putting on pad, the healthcare provider will just be guessing amount of blood you've lost, and again might not give adequate diagnosis of what might cause the bleeding. So please, immediately you notice spotting or bleeding of any kind, so far you are pregnant, make sure that you pad yourself and then rush to the hospital. There are a lot of these things that can cause this bleeding in the uterus. We have abortion, especially spontaneous abortion. Spontaneous in the sense that it happens on its own, it wasn't forced to happen. Then another thing that can cause bleeding in early pregnancy is implantation bleeding. That's your already fertilized ovum. The process of it embedding itself at the line of the uterus, sometimes blood will come out. At least about 50% of women don't see this type of bleeding I'm talking of now, and it is known as implantation bleeding. Some always mistook this implantation bleeding to be the menstrual flow. When you ask them when last did they see their menses, they will tell you that they have seen it twice in a month, whereas it is this implantation bleeding. Then if you're having a ectopic pregnancy, you will see this bleeding in any pregnancy. High datidiform moles, cervical carcinoma, a lot of things that can cause this antepartum hemorrhage. So your part to play in all this is this: if you see this, rush to the hospital. Let your healthcare provider be the one to tell you that no, there's no cause for alarm, you are safe, your baby is safe. You understand? Because I have seen many women that will come to the hospital, they will tell you that it started last night, and before they will come in the morning, they have already lost their baby. And do not say because you are seeing blood, you're not seeing any pain, it's normal, it's going to stop. What if it's not implantation bleeding? What if this is one that will kill the child? Because there are many of them that will not come with pains, abdominal pains, but you will be seeing blood. And there are some that will come with both abdominal pains and then that bleeding. So always make sure that you pad yourself immediately you notice that and report to the hospital. And it is also necessary that when you take in, immediately notice you've taken in, go to the hospital. Let them make sure that you're not having ectopic pregnancy, because this is also one of the things that can cause bleeding in early pregnancy. Please, if this video has helped you in any way, do not hesitate to share, like, and then subscribe for more.